Nothing is more exciting than watching your child on a sports field, dunking a ball, shooting a basket, kicking a goal. Nothing is more frightening when that kid goes down and you don't know what to do about him. Stay with us for the next segment of Kentucky Health when we talk about sports medicine.
Kentucky Health addresses the healthcare concerns of all residents of Kentucky and surrounding states. It was created by Dr. Wayne Tuckson, a colorectal surgeon practicing in Louisville. Here is your host, Dr. Wayne Tuckson.
Hi, and welcome to another segment of Kentucky Health. Today we want to talk a little bit about sports medicine, in particular a few things about getting the athlete ready to participate in sports, and then some of the injuries that can occur, particularly a concussion, as people go ahead and play in these sports. You know, there's a lot of things we try to do now as far as getting our young athletes and even some of the older people ready to play sports. We're finding that people are becoming more committed to a particular sport earlier, and the training seems to be far more vigorous. And with that training, we're really, trying to develop that almost super athlete through how we can intervene through nutrition, through, in some cases, supplementations, in addition to the added and different workouts that people go through. And some may even question, as I do sometimes, is some of this stuff that we're doing to these young athletes really necessary, and are we really benefiting these people, or are they going to be more detrimental? With us today is Dr. Paul McKee IV, who is a member of the Shea Orthopedic Group, who is a specialist in sports medicine. Paul, thanks for being with us today.
Thanks for having me.
Now, I must admit, as I travel around and I see younger and younger kids, I remember seeing a peewee, not even peewee, it was a midget football game where these kids had on these shoulder pads, and clearly they were little pads, but they were too big for the kids. They were running around bumping into each other and falling over. Are we asking more and more of young people earlier than what we should be, or not a problem?
I think in particular with some sports, especially football, I think it's important for kids to get involved earlier than later. I think that there's a certain thing that kids learn about how to be tackled, how to tackle, and how to tackle with the right fundamentals. When they're smaller individuals, the level of the collision is certainly less. So somebody in Pee Wee football, if you look at the force of the collision, it's less than junior high, and it's less than high school, it's certainly less than college. And then you talk about the NFL, the collisions, especially as you saw this last weekend where you had concussions 6 one Sunday afternoon to be relatively high. The force of those collisions is very high. So there's a certain element of having the kids participate at a young age so that they learn how to tackle properly, how to be tackled properly is really important. But having properly fitting equipment for those individuals is certainly very important.
What about, it seems like we're seeing kids pulled into one sport, or you get these kids who are doing field hockey, and they go not only on their team at school, but then they have these club teams and these traveling teams, baseball, softball, basketball. Is that a good thing to do one sport continuously like that?
I think the overall goals of the athlete are important to understand. If these athletes, though at a very young age, decide that that's the sport that they truly love the most, and they have goals and dreams of playing that sport at the collegiate level and potentially on scholarship, I think that the more that they participate in that individual sport, the more opportunity they have to develop the skills necessary to play at that next level. But I think, as most things in life, there's a healthy balance. I think that an athlete can become burnt out, and any athlete that loves their sport, whether it's skilled or not, will play better than somebody who is burnt out and doesn't want to be there. I think there's a potential for having mental staleness if they play the same sport all the time. But I also know that multiple sport athletes are highly recruited, because if you can prove that you're successful in different fields and different arenas, that's attractive to collegiate coaches and makes you more well-rounded as an athlete. I think things just intuitively that are important is playing different sports requires different balance, different mechanics, different muscle mass and technique. And allowing athletes to participate in different sports allows them to develop more balanced. And so that might provide an athlete with more control rather than less in their individual sport.
Does it give muscle groups a chance to rest while you're using different muscles?
I think that's certainly an excellent point. I think having opportunity to train different muscle groups is important. I think that you look at some of our best football players are also wrestlers and track athletes. And during those other off-season events, they are participating in explosive, short-term burst activity in competition, which is what football ultimately is. And so I think that cross-training is important and can be beneficial to the athletes.
I mentioned that you're in sports medicine, and that seems to be a huge term nowadays. So what is it that you do, and how does a person interact with you?
That's a great question, and something that I truly feel very fortunate. It seems new, but the truth is it's been around for a really long time, at least as long as I've been a teenager. I got into sports medicine because I broke my back and neck playing football. I broke 2 vertebrae in my cervical spine and 2 in my thoracic spine, and at the time I had non-operable injuries and didn't require surgery to fix me, but it was going to take 5 to 6 months of recovery with rehab, and I needed to be followed. And at that time I was followed by a primary care sports medicine physician out of Kettering, Ohio. And so sports medicine was around then. It hasn't been like, it wasn't then like it is now, where it's very popular, and it's important because we see the level of athleticism in our younger athletes, as you've alluded to earlier. As it goes higher, the risk for injury is higher, and the more people playing just means there's going to be more injuries. So we need more sports medicine doctors and more people involved in sports medicine, and so I think that's why it's kind of moved to the forefront. There is specific training to be a sports medicine physician, which requires residency and then a fellowship, and you can get there a multitude of different ways, but that's kind of the specific training that you have. The things that I see on a daily basis as a primary care sports medicine doctor is both orthopedic and musculoskeletal injuries that may require surgery or may not. If they don't require surgery, then I'm able to treat the athlete, rehab the athlete, get them back to their best physical condition to return them safely to play. If at any point in time, whether it be on the first visit or the third visit, we decide that surgery may be a better alternative, then I'm able to direct that athlete towards our group of surgeons who are most comfortable in treating that specific injury.
So if you'll forgive the sports analogy, it sounds like you're the point guard in which you're dishing the patient to the surgeon if they need to, I guess to the physical therapist or whoever it is that is going to be best serving that patient.
You probably couldn't pick a better analogy, and it's a total team effort. I mean, I'm on the phone all day, every day with radiologists talking about MRI findings, other surgeons, other primary care sports medicine doctors in the community that we have, where we find an interesting case or patient and we bounce those cases off of each other. A lot of times we do that during sideline coverage. So we cover games on the sidelines at both the high school and the collegiate level, as well as the professional level in regards to the Ironman triathlon and the Derby Marathon and Mini. As well as other running events. They had the U.S. cycling event here in Louisville a couple years back, and then they had the U.S. Senior Olympic Games. And so we covered all those events. And when we're on the sidelines, we've got some time to talk, and we'll talk about athletes that we've seen or cases that we've had in the past week or so or month, and just get ideas as to how to best manage that patient and return them safely to sport.
I guess like many things, and there is a separate society for sports medicine, and then if someone is looking for someone, it's probably better to look for someone in that who is a member of the society? First of all, there's board certification in sports medicine. So in order to be boarded in sports medicine, you have to have been boarded in another area of medicine first. And so then you'll take your sports medicine board exam. So finding a board certified physician, I think, is always a good thing to do. The other thing that is that there are 2 organizations out there, the American College of Sports Medicine, or ACSM, and the AMSSM, which is the American Medical Society of Sports Medicine, are 2 huge bodies that do a lot of research. They're the ones that decide what management guidelines should be. They have conferences annually and do all the teaching. They release publications and have journals and are responsible for the material in the journals. And so those 2 societies are areas where if you were looking for somebody that they'd be an active member of that society, means that they're going to be most up to date on the information that's out there. Let's go through a couple of things, if you would. because these are things that concern me, and I think hopefully other people in our audience. I've oftentimes heard that you should not have a child lifting weights before X age. Now, are there exercises that kids should not do, or there are exercises that one can do by age, and what would be some of your recommendations there?
I think it's, you know, everybody wants their young children to be bigger, faster, stronger. And I think the most important thing to realize is that with young men, they're not going to get stronger until testosterone starts to be secreted. So you can have somebody who's 11, 12 years old attempting to lift weights, but they're not going to get bigger, faster, and stronger until their body starts to mature and that starts to be secreted as a hormone. And so, you know, I think the best thing to do is having your kid doing sit-ups and push-ups and sprints and pull-ups, things that are using their own body weight as resistance is certainly safe. If they can do as many as they want, that's not going to hurt them. Don't expect them to build muscle until they have an anabolic steroid secreted in their body capable of doing so. The other thing we have to watch out for is to make sure that growth plates are closing or pretty close to being closed.
What are these things? What are growth plates?
Growth plates are the area of the bone that start to close when young people start to finish growing. For young women, this happens not long after they start their period. They can continue to grow soon after they start their period for the next 2 or 3 years, but normally it levels off. With young men, they hit that growth spurt at the beginning of puberty, but then continue to grow, you know, into their late teens. It's uncommon for them to continue to grow into their later teens, early 20s, but it has happened. And it all depends on if these growth plates are still open or not. Once the growth plate fuses, the athlete's no longer going to grow, the young person's no longer to grow. And at that point in time, there's low risk to injury to that growth plate or the connective tissue surrounding those growth plates.
So that's one of the things you look at if you're telling a kid to start working out with weights or other types of exercises?
That's right. And I think over time, our strength coaches have realized that normally it's, you know, middle, junior high is probably about the right time for athletes to start working out with weights. I think it's really important for them to learn proper technique at that time to prevent back injuries and overuse injuries. And then during their high school years is certainly a time when weight training becomes important in order for the athlete to be competitive.
Is there a big difference between, say, I guess, using bands, or I guess resistant type things versus using the weights?
There are. A lot of it has to do with the proprioceptive component, which is a big, long, fancy word for knowing where our body is in space. And so proprioception is muscle working in different planes and different actions. The nice thing about a band-like activity is it's always requiring some sort of opposite control, whereas a weight is going to use gravity, and so during the falling portion with gravity portion of that weight, the muscle doesn't have to do as much work to steady it. And then when you look at free weight lifting, meaning that you're lifting a weight that's not attached to any sort of a gliding bar or a band or cable, that requires proprioception to maintain that weight during the entire course of the lift. So certainly that would take more strength, more balance, more coordination, and therefore be a better, more sport-specific lift.
Okay. But as we get older, does it matter? Is the 40-year-old, the 50-year-old, or the 60-year-old who's trying to maintain tone? Any of those three things are about the same, or you favor one over the other?
I think a balance throughout as we age is important. You know, I talk a lot with patients about weight loss and a lot about how to train. And one of the things I think that people miss is that lean muscle mass burns more energy at rest than any other tissue we have. So if you lift weights and you have more lean muscle mass, you're going to have a better chance to maintain that same body of weight and conditioning. So I think resistance training into the later years is very important. And patients that I have that come into the office, I want to encourage them to continue to do that. And ones that, you know, really struggle to want to lift weights, I try to encourage them to start. So.
What about things where you're using your body? You mentioned a little bit about the younger people, but using just the weight of your body as for resistance.
People were in great shape before we had any of this fancy equipment. You know, there were people winning Olympic Games way back in the ancient Greek times. And if you look at these sculptures of these people, none of them were out of shape. They were all, you know, in extremely great condition. So they had to do that some way. And sure, some of it may have been picking up blocks and building buildings and pyramids and things like that, but it also was because they just used their own body weight to perform exercise.
One of the other trends, I guess, which we're seeing nowadays is the nutritional things. Now, I guess part of it is getting more calories, but it seems like a big thing is getting a lot of protein into diets. Now, what is your take on all this?
Protein is certainly important when you're trying to build muscle mass. Protein is the backbone for muscle. It comes in the form of amino acids, and so when you see a lot of these supplements that people can buy at nutritional stores, they're toting these amino acids as being building blocks that people need to consume. If you eat a balanced, healthy diet, there's plenty of studies and research out there to show that you consume enough protein eating a balanced, healthy diet. There are times to eat after exercise that can help you build more muscle protein. Right after you work out, the muscles are starving for energy. And so being able to consume carbohydrate and protein not long after you eat is very important. Not long after you've lifted or worked out is important. And so I think that I don't think you have to take a supplement in protein in order to build muscle mass, but you definitely have to consume enough protein to do that.
So, a young lady who's just finished on the field hockey practice, I guess about 60 minutes of bending over, chasing up and down. What do you tell them? Have a glass of milk, have a candy bar, or do you have a protein shake? How do you look at it?
We at Louisville, we have them take in carbohydrates and a balanced drink after their sport-specific activity that day, whether it be practice. In the extreme versions of all this, there's a lot of time increment levels that you could kind of make yourself crazy about when you should eat certain things. And I think that if you're working with a nutritionist or you've got a strength coach, I think that they're going to be well versed in that. I think as the average individual, I think as long as you consume some carbohydrate in the form of fruits, vegetables, and simple sugar is fine. Believe it or not, if you're done working out and you don't have anything else readily available, one of the best things to drink is chocolate milk.
Really?
The sugar allows for insulin to be released. Insulin is an anabolic hormone within our body. It causes building of muscle. And so if you drink chocolate milk, you've got a healthy balance of carbohydrate, sugar that's free in the form of the chocolate that can allow you to maximize that workout you just had. Sometimes people feel that's a little bit heavy, but a skim milk of chocolate milk is not bad.
So trying to have one of these $5 or $6 protein shakes may not be necessary.
It's definitely not necessary. I think if you eat a balanced diet, you don't have to go that extreme. That's certainly going to enable you to have as much possible protein available to you, but you probably excrete more of that than you could ever absorb.
I wondered about that because it seems like, where does it go? I mean, everything can't be staying in the body.
No, we just have a lot of healthy excrement.
A lot of fish out there swimming that are getting very muscle bound. Now, the other thing, though, I guess, is supplements in terms of trying to make us use that protein more. I guess products like creatine and then even the anabolic, because you mentioned that anabolic steroids naturally being produced, but some people, I guess, want to
push the envelope a little bit.
I couldn't say it better. Yeah,
I think the big thing that we look at with those is that a lot of the extra sources of anabolic steroids they don't come without risk. There's risk of cardiovascular problems, there's risk of high cholesterol problems, there's going to be stress to the liver, and ultimately over time you are robbing Peter to pay Paul. You're ultimately affecting your whole body health in order to have more muscle mass. And that's why you see some of the masculine sex characteristics be more profound, especially if a female athlete starts taking an anabolic hormone, they become more masculinized in certain physical features. But more importantly, that means they're suppressing their female hormones. If you're a male athlete taking anabolic steroids, areas of your body that are supposed to be secreting that, such as your testicles, are going to become smaller, and you're going to decrease your sperm count, and ultimately to possible infertility, all because of an anabolic steroid. Certainly these things work. I mean, if they didn't work, people wouldn't use them. I mean, it's not that far-fetched to understand why athletes could be tempted. Fortunately for us, we have guidelines by the NCAA that tell us that you can't do it. So our athletes at the college level are certainly encouraged to not use that, because it would cost them their season, and their careers are short enough as it is. The problem with a lot of the supplements out there is there's no organization required to test these substances. So walking into your local nutritional store and taking something off the shelf that says that it will make you have more muscle, it may have steroid in it, and they don't list it on the label. They're not required to. The FDA has been, since 1994, kind of tracking these things, but it's just too much for them to track with all the other stuff they have to check with the food and drugs that we have. Supplements are not one of their concerns. It's one of their concerns, but something they don't have the ability to do. People that, the companies that manufacture these products aren't required to do any more than test their own products, but they don't have to list everything that's in there or talk about the amount of what's in there. And so these labels they're on the product. That's what the FDA says. You have to have a label, but they don't have to say that the label is what it is.
So don't have to have everything in there.
And then you'd mentioned creatine, which is a supplement that came out when I was in college. It was highly tested and taken by a lot of athletes. Still, many athletes take it today. Creatine is one of the products that allow our muscles to recover from exercise, but it's only from anaerobic exercise, short burst activity. And creatine doesn't come without its own side effects. Creatine can cause the muscles to swell because it allows the muscles to withhold more water, but that water is not within the blood vessels. So the rest of the body can be dehydrated even though the muscle has plenty of water. So intravascularly you're dry, but the muscle is swollen. Things that are interesting about creatine to me is it's amazing the number of people taking it, but creatine, if taken with large amounts of caffeine, becomes completely ineffective. It has no way to bind to the muscle in order for the muscle to allow more energy to get in the form of what we call ATP. And so there was a really nice study done in 2007 that showed that even minimal amounts of caffeine ingested at close to the time when, or around the time when creatine is taken, makes it completely ineffective. So now you're taking a supplement, assuming side effects and risks that aren't even giving you the benefit of the supplement itself. So it gets to be pretty complicated, but there are people out there studying it. So.
Since you mentioned about fluids and hydration, there's a whole number of products out there now, Gatorade, Powerade, all these things. Is it really better, any of those things really better than water or juice or something like that?
It depends on, I think, and this is something that one of the organizations has realized relatively soon. They've come out with different drinks for different parts of your workout. And I think that that makes a lot of sense to me, that you need certain balances in your hydration status and the beverage that you're consuming at different parts of your workout, whether it's pre-workout, during the workout, or after the workout. Water is the most important component. As a sports medicine physician, I always encourage our coaches to keep our athletes well hydrated. And I think in the last several years, our coaches are really getting it. If your ultimate goal as a coach is to have your athlete performing at the highest level that they can at any moment in time, he or she is going to perform better if they're well hydrated. And withholding water or using that as punishment just doesn't make sense. And I think our coaches and our athletic trainers do a great job of making sure our athletes are well hydrated. But giving them electrolytes throughout the course of their workout in the form of potassium and sodium, I think, is also important.
So the stuff that's in some of these drinks, it's not harmful, it's good for them.
Not harmful, and it's good for them. The worst case scenario for all those things is they're water soluble. So you're just going to pee them out if you don't absorb them and use them.
A lot of expensive pee, though.
There's a lot of expensive urine in this country, that's correct.
So the best time to hydrate, is it before the practice begins?
Definitely before. You've got to be well hydrated before any event. And hydration starts over the course of even days before. If you have an athlete that's subjected to cramping, you've got to focus on how well they're staying hydrated 2 days before a football game, for instance, and making sure they keep up an adequate level of hydration. We tell our athletes all the time, it's real simple. Your urine should be clear. Your urine should not be concentrated. If it's yellow, then you're not drinking enough water.
Well, Paul, I want to thank you very much. I think clearly technique is a very good thing. If you have any questions, talk to your doctor, but nutrition, you don't have to buy those expensive products over the counter. Just simple things of buying a whole chicken, cooking it, feeding it to the kid. Peanut butter and jelly still works, and it's amazing. A glass of milk actually can be of some value. If you have any questions, feel free to contact Dr. McKee at Shea Orthopedic Group, or feel free to contact your local physician or us at KentuckyHealth@insightbb.com. Dr. McKee, I'd like to thank you very much for being with us, and thank you for joining us in this segment of Kentucky Health. Look forward to seeing you again.